Okay, so tonight we're going to learn about corona polishing. Everyone knows what polishing is, right?
Mm-hmm.
Okay. Who likes the polishing of the dentist? Good. I absolutely hate it. Oh, I hate it. Okay. So our learning objectives for tonight. We're going to pronounce, define, and spell the key terms. Explain the difference between prophylaxis and coronal polishing. Explain the indications for and contraindications for coronal polishing. Name and describe the types of extrinsic stain. Name and describe the two categories of intrinsic stain. And describe types of abrasives used for polishing. So, the introduction. This is important to know. Coronal polishing is a technique used to remove plaque and stains from the coronal surfaces of the teeth. Polishing the crowns of the teeth is considered mainly cosmetic, but there are instances in which coronal polishing has therapeutic value as well. Everybody knows what the coronal portion of the tooth is. In some states, coronal polishing is delegated to registered or expanded function dental assistants who have had special training in this procedure. Coronal polishing is strictly limited to the clinical crowns of the teeth. Coronal polishing is not a substitute for an oral prophylaxis. It's not going to remove calculus or tartar from the teeth. Selective polishing is a procedure in which only those teeth or surfaces with stain are polished. The purpose of selective polishing is to avoid removing even small amounts of surface enamel unnecessarily. In some individuals, stain removal may cause dental hypersensitivity during and after the appointment. Do any of you guys ever experience that at all? Okay. Alright, so coronal polishing and fluoride application. Historically, teeth were polished to remove all soft deposits and stains before the application of fluoride because it was believed that there would be greater uptake of fluoride. As scientific knowledge has evolved, it has shown that polishing does not improve the uptake of professional applied fluoride. Therefore, polishing is no longer necessary before a fluoride application. So, the benefits of coronal polishing. Polishing prepares the teeth for the placement of dental sealants. It smooths the tooth surfaces that are easier for the patient to keep clean. The formation of new deposits is slowed, and patients appreciate the smooth feeling and the clean appearance of polishing. And polishing prepares teeth for the placement of brackets for orthodontics and bands. So, dentinal stains. Stains of the teeth occur in three basic ways. The stain adheres to the tooth directly. The stain is embedded in the calculus and plaque deposits, and also the stain is incorporated into the tooth structure. It is important to distinguish between the types of stains before polishing. Dental stains. Again, stains are primarily an aesthetic problem. Some types of stains can be removed and others cannot. Do you guys know maybe any difference between stains that can be removed and some that can't?
Well, I would think fluorosis can't be removed.
Mm-hmm. Yep. Sounds good. Good job. There are other treatment options for patients that have stains that can't be removed, like fluorosis, veneers, crowns, bonding. These include professional at-home bleaching procedures, enamel microabrasion, cosmetic restorations, such as veneers and composites. Types of dental stains. They are characterized as endogenous and exogenous. Endogenous stains originate within the tooth as their development or systemic disturbances, such as fluorosis, problems when, like, my dad had tetracycline stains from taking tetracycline as he was a kid. Exogenous stains originate from outside the tooth in response to environmental agents. Exogenous stains are those stains that are caused by environmental source. They are also subdivided even further as extrinsic or intrinsic stains, depending on whether the stain can be removed. So, extrinsic and intrinsic stains. Extrinsic stains are stains on the exterior of the tooth that can be removed. Examples are food, drink, tobacco, so coffee, tea, red wine, cigarettes, all the fun things in life. The source of the stain is external and the stain may be removed. Intrinsic stains are caused by an environmental source but cannot be removed because the stain has become incorporated into the tooth. An example of this is tobacco stains, chewing or dipping, the stains of the dental amalgam that become incorporated into the tooth. Does anybody have any of the amalgams where their teeth are starting to turn like a grayish color around it? So you just can't. You're not going to be able to get those off. So this is an example of an endogenous developmental stain, the tetracycline stain that I was just talking about. You can see how there's just a different color of the tooth, but no matter how much you polish, that stain's not going to come off. And again, enamel hypoplasia, where you can see on the lateral more that those little brown dots, those aren't going to come off. And fluorosis. Does anybody have any of these? So an endogenous stain, this is like secondary caries. And stains from an amalgam. It takes a while for amalgams to see that they do, unfortunately. So, methods of removing plaque and stain. There's air polishing and rubber cup polishing. Has anyone ever had the air polisher used on them? Okay, good. The air polishing technique involves the use of a specially designed handpiece with a nozzle that delivers a high pressure stream of warm water and sodium bicarbonate, so it's kind of like a power wash. But there's a lot of medical indications on not to use air polishing, like asthma, because all the fumes and the water gets in your face. I really have never used it either. But then rubber cup polishing is the most common for removing plaque and stains. A rubber polishing cup is rotated slowly and carefully by the means of the prophylactic angle attached to the slow speed handpiece. So the polishing cups. I hope you don't mind, but I raided the supply closet. I'll put them back. So their soft web polishing cups are used to clean and polish the smooth surface of teeth. The polishing cup is attached to the reusable prophylaxis angle by means of a snap-on or a screw-on. So it's cool. A couple, if you want to pass them around, you can just see the rubber cup, how it's kind of soft, and it definitely is a little flimsy. So the one on your right is the one that you're going to be seeing. And the one on the left is the snap-on or screw-on polishing. And also, I stole some bristle brushes. So the bristle brushes are made from natural or synthetic materials, may be used to remove stains from deep pits and fissures of the enamel surfaces, so grooves of your teeth. But you want to make sure that when you use them, you only use them on the occlusal surfaces, because if you can kind of see that these are, they're soft, but if you put them when they're spinning next to the gums, it'll definitely cause some damage. So you just want to make sure when you're using them, you use it really carefully. Brushes are not recommended for the use on exposed cementum or dentin because these surfaces are soft and are easily grooved. Has anybody ever seen the bristle brush before? Use it a lot with like coffee or tea drinkers, red wine, because the stain gets in the grooves. or in ortho, which you can get around the brackets easier. So the polishing agents. They're dental abrasives polishing materials are used to remove stain and to polish natural teeth, prosthetic appliances, restorations, and castings. They're available in extra coarse, coarse, medium, fine, or extra fine grits. The coarser the agent, the more abrasive to the tooth surface. I think a lot of people just don't like this part because of the grittiness. Sand. Even a fine grit agent removes small amounts of enamel surface. The goal is to always use the abrasive agent that will produce the least amount of abrasion to the tooth surface. Start at. So chapter 8. Thanks.